Hi, I'm Debbie Toms. I've been a nurse for 25 years. I went to Spalding for a 4-year degree, and I went there late in my life at 36 years old. I started in at Baptist in a hospital setting, and it was medical surgical, which carries just about everything that you can think of. What led me to BrightStar was my son, because he had some friends at BrightStar. The biggest difference is you really get to be a part of the family dynamic, that you learn a lot more about your patient faster. Seeing the dynamic in the home, what needs to be done, and watch the heroes that are in the home.
Well, I decided to leave the emergency room just because of life circumstances. I do have children who are a part of our JCPS school system, and with their recent changes, I had to also make changes to my schedule. But I am grateful for the experience that I had there. I chose home health because the bulk of my career has been working with individuals with intellectual and developmental disabilities. I've done pretty much everything you can think of on that side of things, and it was just a natural next step to move into like a more private setting. Medically. Yeah, I definitely think a good foundation is imperative when you're trying to come into home health, because you are here pretty much by yourself along with the family. So I think confidence in yourself is important. Being able to ask questions, not being afraid to ask questions is a huge thing. Just taking your time to do your research in the field that you're going in, the skill sets that are needed. I think that all of those would be great qualities to have. I think for me, the fundamentals are definitely knowing your assessments, being able to assess your patient, being able to look something up if you don't know, and that's totally okay. I definitely think, you're focusing on your basics, airway, breathing, and circulation is to keep the patient alive. Do what you need to do to be able to just care for that patient in that home. Doing your research once you figure out what the niche is, and just working your skill set from there. And like I said, asking questions, doing trainings if you need training.
For private duty nursing, you don't necessarily have to have experience in private duty nursing. When I did private duty nursing, I had zero experience in it. Basically, you just take your nursing foundation skills and then you specialize them towards that patient's needs. You're able to provide the one-on-one care. You don't have to worry about juggling a huge team of patients. You have that patient to focus on for the entire day. So it does require some flexibility, but it does help you to fine-tune your skills for working independently, being able to troubleshoot on your own, having the autonomy to be able to triage different things that are going on with your patient. Families are basically looking for someone that can come to the home and just kind of put their mind at ease, whether they have to go to work for the day and feeling safe knowing that their child or their mom or dad are taking really good care of while they're at work. It lifts that load off of them to know that they have someone that's dependable, reliable, that is able to provide that care for them without feeling like they have to be in the home all the time. So the uniqueness of private duty is the flexibility of it, and being able to customize it to meet the nurses and families' needs kind of together.
Some are energetic, some are compassion, like the mother figure. But it all works together.
I think that the training was very personalized with Lee, which I did appreciate. We went over a lot of things. I think the charting is very efficient, and you're able to chart what you need to chart, and it also helps you to remember what you need to be doing as well. I like that BrightStar curated a form that goes over, it's basically like a paper MAR that just goes over times and medications that are due, treatments that may be due, tasks, things like that. So that helps to keep me in line and focused and on time with everything that I need to do.
You have to be willing to learn everything in this place or each place that you go, which is a little different because when you're in the hospital, you're going from person to person to person to person. This is just totally different. And so, and you can, even though it's private duty and you might be working with just one person, there are a lot of things that you can learn that you've not done in other places.
Yeah, Ty had a homecoming. We had a 2-day event. The first day, They did the victory walk at the hospital, and it was amazing. Unfortunately, I didn't get to go, but I seen the video, and it put a lot of tears in the hospital staff. They did an amazing job, got them back. When we got here, family and friends came over day one, had balloons everywhere. Like I said, he loves balloons. If you look up at our ceiling now, we still got some there. It made you appreciate life. Well, in our family, we might joke about it, but we call him Lazarus. He's risen from the dead multiple times, and he's a fighter. He's definitely a fighter, and he's gonna keep fighting.